Why is bone marrow biopsy done for chronic lymphocytic leukemia? Imagine trying to understand how deeply a disease has affected your body. In chronic lymphocytic leukemia, a bone marrow biopsy helps doctors see inside the spongy tissue inside your bones where blood cells are made. This procedure is important because it shows how much leukemia cells have invaded the marrow. When leukemia cells grow out of control, they can crowd out healthy blood cells, which can cause issues like infections, anemia, or easy bruising. By examining the marrow, doctors can tell if leukemia is affecting normal blood cell production and how severe the disease is. A bone marrow biopsy isn't always needed to diagnose chronic lymphocytic leukemia because blood tests and lymph node biopsies often give enough information. But sometimes, these tests do not provide a complete picture. In those cases, a biopsy becomes essential. It helps confirm the diagnosis, especially if the blood tests show abnormal lymphocytes but do not clearly indicate how much the marrow is involved. Doctors also use this test before starting treatment to understand the disease better and to plan the best approach. It can also be used later to see if treatment is working or if the disease is progressing. The procedure involves numbing the skin over the pelvic bone, usually at the back, and then inserting a thin hollow needle into the bone to remove a small sample of marrow tissue. This sample is usually about the size of a grain of rice. The process takes about 30 minutes and is generally well tolerated, though some people may feel brief discomfort. Once the sample is collected, it is examined under a microscope to look for leukemia cells, assess how well the marrow is functioning, and perform genetic tests. These genetic tests can identify specific abnormalities that influence how the disease might behave and what treatments might be most effective. The information gained from a bone marrow biopsy helps doctors determine the stage of chronic lymphocytic leukemia, which is important for deciding on the best treatment plan. It also helps identify genetic features of the leukemia cells, which can give clues about prognosis and guide personalized therapy choices. Additionally, the biopsy can reveal whether the disease has spread beyond the blood and lymph nodes into the marrow, which can impact treatment decisions. In summary, a bone marrow biopsy in chronic lymphocytic leukemia is done to confirm the presence of leukemia cells in the marrow, understand how the disease affects normal blood cell production, identify genetic features that influence prognosis, and monitor how well treatment is working or if the disease is worsening. It is a valuable tool that complements blood tests and imaging studies, helping doctors create a comprehensive picture of the disease. Always remember, if you or someone you know is facing this condition, consulting a healthcare professional is essential for personalized advice and care.